Imagine managing your diabetes or weight without a single injection. It sounds futuristic, right? Well, Eli Lilly's latest oral GLP-1 receptor agonist, or Orforglipron, may be bringing the future to your medicine cabinet. Welcome back to TheClinResearcher, where we explore the latest clinical trials and innovations shaping tomorrow's treatments. Today, we are going to be covering how Orforglipron actually works. Also, what does the clinical trial data say about Orforglipron? Not just the newest data, which we are very excited to share, but also previous clinical trials. And of course, how does it compare to the other oral GLP-1 therapies? There is another medication that comes in a pill form, but how does it do compared to that one? The side effects, which are very important when talking about any kind of medication, and you won't want to miss this. Make sure you guys watch the video till the end because we're actually going to be talking about a clinical trial that is currently enrolling for the medication Orforglipron. So I do want to make sure that we cover what the clinical trial involves, who might benefit from it, and how you can actually go onto this site and look up research studies that you can participate in. Let's get right into it. As a disclaimer, this video is for educational purposes only. It is not intended as medical advice. Make sure to always consult your healthcare provider before making any changes to your treatment. Before we dive into the latest data, here's how medications actually progress through the approval process. In phase 1, the safety is tested in a small group. In phase 2, the effectiveness and the dosages are examined. Phase 3 is where thousands of participants are studied to compare with current treatments. If this data is good, the company files a new drug application, an NDA, with the FDA. Then comes the approval, labeling, and market availability. So only after all these things are completed are we able to get the medication prescribed or over the counter depending on what kind of medication it is. That's why today it is so exciting to cover what the phase 3 trials of this medication have to say. So how does it actually work before we go into the clinical data? Orforglipron is part of the GLP-1 family, but it is different. Unlike injectable GLP-1 therapies, which are peptides that require cold storage and are broken down in the stomach, Orforglipron is a small molecule drug. This means it is chemically stable and can be absorbed orally, making it more convenient and accessible for patients who may be adverse to injections. They don't want to have to inject the medication, or they just require a simpler administration route. It is a small molecule drug you can take by mouth. Most other GLP-1 drugs, like Ozempic or Trulicity, are peptides and they need to be injected. I've talked about all of these GLP-1 drugs on the channel, so make sure you guys find that video if you're interested in therapies that are actually available out in the market right now. So how does Orforglipron actually work? It works by mimicking the body's glucagon-like peptide 1, which is going to have these effects. It is going to stimulate insulin release, suppress glucagon, slow gastric emptying, and increase satiety, all of which help lower blood sugar and reduce appetite. But there's also another added benefit that has been studied for diabetic patients, and it has to do with something that's called A1C. So what is it and why does it matter? A1C is a measure of your average blood sugar over 2 to 3 months. And there's different ranges you get for this. Normal would be less than 5.7%. Pre-diabetic is 5.7 to 6.4%. Diabetic is anything above 6.5%. So if you lower the A1C, you're reducing the risk of long-term complications. And it's one of the main targets for any diabetes therapy. So what did the phase 3 results actually show? There's a trial called Achieve-1 trial, which had over 500 adults with type 2 diabetes, and they took Orforglipron for 40 weeks. The high dose group achieved an average A1C reduction of up to 1.5% and weight loss between 4.7% to 8.6% from their baseline. If these results are replicated in upcoming studies, Orforglipron could rival injectable GLP-1s. Now let's backtrack a little bit. Sure, Orforglipron just had their phase 3, which had amazing results and was a success for that trial. However, they had already conducted multiple phase 2 trials. So let's look into that. There was actually an obesity trial, which is for people without diabetes, and they actually lost up to 14.7% of their body weight over 36 weeks. And there was another trial for type 2 diabetes, which was a head-to-head comparison between Orforglipron and dulaglutide, which is a well-established injectable GLP-1 agonist branded as Trulicity. I'm sure you guys have heard of this. This one has been out for a while, and they wanted to compare these two, the new medication Orforglipron to dulaglutide. And dulaglutide helps by lowering A1C by around 1.1 to 1.5%, and it supports modest weight loss. However, in this trial, Orforglipron showed superior reductions in A1C and weight, suggesting it may be more effective and easier to take. So how does it compare to the other oral GLP-1 therapy, which is Rybelsus? Orforglipron is a small molecule, while Rybelsus is a peptide. Even though both of them can be administered orally, there is no food restriction for Orforglipron, which makes it a lot better for patients who don't want to be restricted to fasting, which you had to do in Rybelsus. There's also an A1C drop for both medications, and that's why they're both being looked at for diabetes. However, Rybelsus showed about a 1.2% reduction, and about a 1.5 reduction was seen with Orforglipron. Now, how about weight loss? Well, Orforglipron showed up to 8.6% weight loss, and Rybelsus, patients lost about 4.4 kilograms. So Orforglipron stands out with fewer restrictions, more flexibility, and greater effectiveness in both A1C reduction and weight loss. If the rest of the trials hold up, and by that it means results from other ongoing phase 3 trials like the Achieve-2 and the Achieve-4, and trials focus on obesity without diabetes. Once all of this comes back, it will potentially be one of the best oral GLP-1 therapies on the market. Now, how about side effects? There are no miracle drugs, right? Everything comes with a side effect, and these are going to differ amongst individuals. However, here are some of the most common ones. Orforglipron, like the other GLP-1 receptor agonists, are generally well tolerated but may cause some gastrointestinal side effects. Some of the most common reported side effects include nausea, diarrhea, vomiting, decreased appetite, constipation, abdominal discomfort, and dizziness. There is a risk of hypoglycemia, which is when your blood sugar drops, but it is considered low unless the drug is used in combination with insulin or insulin secretagogues. Now, I promised we were going to look into currently enrolling trials for Orforglipron. Unfortunately, a lot of the trials have already finished recruiting, and that's how we have this information. So if you guys want to stay up to date on new trials that are coming out and you're interested in participating, make sure you check out our website, TheClinResearcher.com. And through our newsletter, you will learn more about clinical trials that are enrolling. So make sure you guys do that so you don't miss out if you are interested. And of course, before that, make sure that you talk to your healthcare provider to see if it is right for you. So let's take a look at the trial that is currently enrolling at this moment. Here we are at clinicaltrials.gov. This is where we can learn about clinical trials that are enrolling, recruiting, or have already closed, but we can get all types of information about clinical trials. So we're gonna go down here, and you can type by condition. So you could do weight loss, you could do diabetes, or since we already know what medication we're looking for, we're gonna type in Orforglipron. I'm going to set it to all studies just so that we can see what is going on with these studies. And as you see here, active, not recruiting. They already finished recruiting the amount of participants that they needed, and now perhaps they're looking at the data, they're submitting applications in order to get to that next phase. So with that being said, if you guys want to stay up to date before they finish recruiting, if you're interested in participating, head over to our website. However, for now, let's go ahead and set up the filters on this side, on the left side, to recruiting. And we have 3 that are recruiting at the moment. Let's go ahead and apply the filters. And here you will see that there's actually a study for Orforglipron in adolescent participants with obesity. There's also a study for participants who have obstructive sleep apnea and obesity or overweight. This one is very fascinating because it is gonna potentially become a possible treatment for obstructive sleep apnea, which a lot of patients suffer with. And then finally, there's a trial for pediatric participants with obesity or overweight. So these are 3 clinical trials that are currently enrolling, and I wanted to look into this one for obstructive sleep apnea because a lot of times obstructive sleep apnea come hand in hand with obesity or being overweight. So the purpose of the study is to evaluate the efficacy and safety of Orforglipron in participants who have moderate to severe OSA and obesity or overweight. If you wanted to see if you qualify for this study, you would check participation criteria here on the left hand side, and it's going to give you eligibility criteria. There's inclusion criteria, which means you have to meet these, and there's exclusion criteria, meaning that they don't want you to have any of these here. If you have anything listed, there's a low chance that you will be able to enroll. However, it is always best to contact the clinic and check it out for yourself. See if there's anything they can do for you, or if there's any other study that you might potentially be able to participate in. Now, if we scroll up here, or you can click on contacts and locations on the left, there's actually 78 locations that are currently enrolling for this trial. If you're interested in participating in a clinical trial such as this one, make sure you guys head on over to clinicaltrials.gov, which is the website that we're on right now. And with that being said, if you guys need any additional help, please visit our website at TheClinResearcher.com. You can find educational guides so that you have a better understanding on what clinical trials are and what you can expect by participating. Of course, make sure you always consult with your doctor or your healthcare provider before deciding whether a clinical trial is right for you. With that being said, if you have any questions at all, please leave me a comment down below and I will make sure to answer it. And you can also reach us at TheClinResearcher.com. Also, make sure you guys get our free ebook that is going to show you exactly what you need to know in order to prepare for your participation in clinical trials. Thank you so much for joining. I hope you enjoyed the video, and I will see you on one of these other videos that YouTube is recommending for you.